right now we're live on YouTube too, so we're just trying to connect the Zoom to the YouTube.
And just let me know when you'd like me to start.
Okay, we'll let you know right.
Okay, so I started streaming. If one of either Ellen or Scott could let me know that it's live.
Yeah, it's live. It's live.
Great. Well, hi, my name is Sanj. I'd like to thank the virtual dental shadowers for inviting me to be the inaugural guest. And I'd like to welcome all of you. This is fantastic that you're spending the next hour with me to learn about my journey. And I hope you get some useful tips that you can use in your dental journey. So if you'd like to contact me, you can email me at sanjuktamohanta@hotmail.com. I'm also on Instagram at Dr. Sanj Mohanta. Please follow and send me a DM. So what will you learn from this? So even though I'm going to spend the next hour talking about myself, this is all about you. It's all about how you're going to improve your dental school experience and get the most out of your dental career. So about me. So I was a very unlikely dental student. And for a while I was even an unhappy dentist. So I'm surprised that, and actually very honored that I was asked to speak to you today, because my dental journey is quite different than most. So I actually never wanted to be a dentist. I wanted to be a university professor, and I was well on my way during my undergraduate degree in biology. I was a teaching assistant. I signed up to do a research project, but when I was doing my research project in fourth year, I realized that I hated research. So I had to walk across campus, go to the guidance department. There was a young lady there in her 20s, and I said, I have a science degree and I don't know what to do. All I know is I don't want to do research. So she opened up the filing cabinet, and there was only one thing in there, and that was the application to write the DAT. And I didn't even know what the DAT was. And she's like, well, it's for dental school and you better decide soon because the application deadline is coming up. So I applied to write the DAT. Luckily, I did very well. And fortunately, I had all the prerequisite courses to get into dental school. I applied to 2 dental schools in Ontario, Western and Toronto. And luckily, I got into both on the waiting list. And that's the first time I publicly said that. I was so ashamed that I was on the waiting list to get in, because when I went to dental school, everyone was so smart and I didn't think I belonged. And even the first few years after graduating, I was like, is this the right career for me? But 22 years later, I love this profession. I can't think of doing anything else. And I would do it even if I didn't get paid. So just some background information. I have a Bachelor of Science in Biology that I got from the University of Waterloo. I went to the University of Toronto for my dental degree, which I got in 1999. And I also have a certificate in teaching in adult education that I got when I was teaching at a dental hygiene school. So for my work experience, I started off as an associate at several different offices. I did that for about 7 years. I worked at a dental hygiene school teaching theory courses and as a clinical instructor for 8 years. And I've been working in public health for about 14 years now. And that's where I am now. I work at a community health center treating children and seniors on publicly funded dental programs. So even though I got into dentistry by accident, looking back, I actually realized that dentistry is the right career for me. In middle school, I did very well in woodworking. I was top of the class in there, so it shows that I was good with my hands. And this is a picture of me from grade 10. I was really rocking that outfit. And this is my grade 10 science project, which I got second place in, and it's all about, teeth. It's all about which toothpaste is the best. And my research back then showed that Colgate was the best toothpaste. So I did have some, early inklings in dentistry. So this is my family. I'm married. I have a son who's in first year university, and my daughter is in grade 11. I also have a dog, and her name is Dude. And this is a presentation I did for a kindergarten classroom, an online kindergarten classroom where we're wearing matching scrub tops and glasses. Okay, this is my dental team. So I have a fantastic team, and I love to go to work each day, and I love the kids and I love the seniors. And I hope that, when you're working as dentists, that you love your job as well. You can have a fantastic career in dentistry. I actually, don't even want to think about retiring. I want to do this until I can no longer do it. Okay, and this is my class from two years ago. We celebrated our 20th class reunion. So, we still have kept in touch all these years, and it's because of my classmates that I got through dental school. So besides dentistry, I do a lot of things outside of dentistry that are related to dentistry. So I'm very involved in organized dentistry. So I'm involved at the local level with my dental society, the Halton Peel Dental Association, where I was the president in 2015. And I'm still on the executive. Also, provincially, I'm volunteer with the Ontario Dental Association, where I'm the chair of the Community Services Committee. I'm also a political contact dentist, a counselor. I'm a committee member with the Advocacy Committee, and I'm on the editorial board of the Ontario Dentist Journal. And I'm also involved with our national dental organization, the Canadian Dental Association, where I was on the Futures of the Profession Task Force, and I'm currently on their advocacy committee. So I love being involved in organized dentistry because I was the one who was always, raising my hand and giving feedback, thinking, why don't you do this? How about this? And I always felt that, some of the decisions weren't being well represented by everyone in the community. So I wanted to give my own perspective. I also do a lot of community service. I do presentations to classrooms, to seniors groups, and I do prenatal presentations. And I love working with kids, as you can see. And if you see this little boy's t-shirt, not only does it say keep calm and carry on, but it also says no breaks. So, I have fun each day with all the kids and their interesting stories. I also do advocacy. So I have successfully advocated to keep fluoride in the community water in our region. And I also speak with politicians about improving publicly funded programs. So this is a picture of me with Jagmeet Singh. He is the federal leader of the NDP, but before that, he was my local MPP. So we've had lots of discussions on how to improve access to care for publicly funded dental programs. I'm really happy to see that he's advocating for that at the federal level. I'm also an educator, so I taught at a dental hygiene school for 8 years. I have a teaching certificate, but I also do public speaking for different groups and at conventions, and I also write articles. And I'm also happy to be here educating as well. So that takes us to my dental school experience. So I really wish someone told me before I went to dental school how much it sucks. You're probably laugh going, what? I'm working so hard to get into it. But it's really tough. And no one ever told me that. And I didn't expect it to be that grueling. It is harder than any of the toughest semesters you had in high school or in undergrad. And, the instructors are constantly, scrutinizing you. And I wasn't used to that. I was used to being the top of the class. Now, all of a sudden at dental school, you're in a class of all-stars. They're all so bright. And I felt so inferior. And that attitude, that bad attitude I had, actually really affected my dental school experience. And even though those 4 years were tough, I actually wish I can go back and do them again, not even pay for it again. Because even though I was paying full price, I only got half the experience. And that's no one else's fault but my own. It's because I was so shy and so intimidated that I was afraid to ask questions. I just want to get through. And that is the worst type of attitude for a student. You're in school because you're learning. You don't know anything about dentistry when you get in, even all the other bright students in the class. And you're all gonna learn at different rates. And the first time you try something, you're not gonna ace it. Even the 10th time, you're not. Even 10 years after dental school, you're gonna make a mistake. That's why dentistry is called a practice. You're always practicing it. And I was just so demoralized, and that affected my ability to excel at school. And that's probably why I didn't do well the first 3 years after graduating as well. So if I had advice for those of you who are going into dental school, be prepared, it's tough, but also be prepared that it's a learning experience and you're there to learn and to ask questions. But dental school was also a lot of fun. It was actually one of the best 4 years of my life as well. I had great classmates and I'm still friends with today. In the early years of dental school, we got to practice on each other. We did a lot of fun things outside of the classroom. There was a lot of socializing. I was on school council, so we organized events for our classmates as well. We didn't get business courses in dental school, so we used to organize them after school. We organized our own prom. We had fundraising activities. We volunteered at the open houses at our school. And every year our dental school would have a show called Dentantics, where we'd put on a bunch of skits and have a lot of fun. So it was a lot of fun, but it was also tough as well. And one of the best experiences of dental school was when I was in my 4th year. I volunteered for 2 weeks to go to Moose Factory, which is an Indigenous reserve in Northern Ontario. And it was a great experience to work with the Indigenous community, to learn more about them, and also to learn some independence as well. So what I wish I did differently in dental school, number one, I wish I asked more questions. So because I didn't ask questions, guess what happened after dental school? I didn't know what I was doing. And I had to spend even more money taking courses to learn the things that I should have learned when I was in dental school. So you're spending a lot of money, you're spending a lot of time, you have all these great instructors there. Ask questions. And don't be afraid to be vulnerable and say, I'm not sure, I'm not confident, please give me some help. And it's interesting that I found this picture because I remember with this little girl, she was in the ortho clinic, and it was a procedure that left me in tears afterwards. It was a simple procedure where I just had to put a separating wire between her first and second upper molar to create a space so that I could put a molar band on her tooth later to hold her headgear. And it took me 2.5 hours and I still couldn't do it. I asked the instructor for help. I still couldn't do it. She was crying. I was crying. So, all these years later, I still remember. And that's because I handled it so badly. The first few attempts when it didn't work and when my instructor tried to do it, I should have just stopped and said, we need to have another option. Let's just wait until the second molar erupts a little more. Let's, see if there's another type of appliance we can use instead of creating a bad experience for her and one for me. So then again, here I was not asking for help. The instructor didn't realize that we were suffering together for that long. He just assumed that after he tried it, I tried it later and it worked, but it didn't. So I don't want to, make the dental experience sound really bad. I want you to.
Dr. Mohanta, we can't hear you.
Oh, okay. Can you hear me now?
Yes.
Okay. And do you want me to go back a slide?
No, you're fine.
Okay. The other thing I wish I did differently in dental school was to be prepared to be critiqued, because every day you're being marked on your performance. And I wasn't used to that at all, because I'm used to, high school and undergrad, you wait till your final exam and then you get graded. You're not graded in front of your peers. You're not graded in front of your patients. You're not criticized in front of other people. So my advice to all of you is to actually write, even today, have a piece of paper and say, if I fail at something, I will do this. If I need more help, I will do this. If I feel like quitting the program, I will do this. And actually, when you get to those points, in your school career or in your life where you feel demoralized, go back to that sheet and follow those instructions. Otherwise, you're going to do the wrong thing. And when you do fail something, when you do perform badly, you're going to do the wrong thing, which is you're just going to be upset with yourself, call yourself some bad names, and maybe even leave the program. Or maybe even be so discouraged that you don't want to try that procedure again. So instead, be prepared that you're not going to do well in everything. And you probably will fail a few things. And you're not going to get A's in everything. So have that sheet to go back to, so then you're like, yep, I'm ready. I knew I was going to fail something. I did. These are the steps I have to do to deal with it, so that I can go back to school the next day and do it even better. So as long as you're improving each day, it doesn't matter if you got a bad mark one day or you failed something. As long as you have a plan on how you're going to get better in the future, you're going to do well. Okay, so my study tips. So my number one study tip is to study with a friend. But okay, I'm going to say this first. It doesn't mean you do all your studying with your friend. It doesn't mean you study and socialize at the same time. This is assigned time just to study, and this is to study after you reviewed the notes yourself. And the reason why I like studying with a friend is because you're actually teaching each other. So what I used to do is get together with a friend after I reviewed my notes and just say things like, okay, tell me about the types of lesions, white lesions that you'll see in the mouth. And if he or she starts listing them off, I'll say, okay, that's good. Here are the ones you missed. So, and then they'll ask me a question. Name some of the red lesions you'll find them in the mouth. So we're actually teaching each other. And then I remember when it came time to the test, I would remember things like, oh yeah, I remember my friend told me about this lesion and the tips she remembered on how to memorize it, or that, oh, I remember this lesion because my friend said he actually had it. And so you remember all these stories. Another thing is when you're studying at your desk, to only study 1 hour at a time. So no power marathon study sessions, because you're going to find you're not going to be as focused, and you're going to get distracted. So study for 1 hour, then actually get up and do something physical. So it can be, going up and down the stairs in your place, or, doing some chores. So something physical, and to give yourself some time to process the information. And you can also, review the notes in your head that you just studied. And instead of rewriting all the notes or rewriting things from the textbook, take the information you read from the textbook and your notes and summarize them into your own words, and actually write it out or type it out. And then for each section, don't go on to the next section until you quiz yourself that you know that. So going back to our white lesions example, so if you just studied the section on white lesions, summarize all your notes, and then cover the note, and then quiz yourself on all the white lesions. And then look at your summary and see if you got them all. Then if you got all the white lesions, now move on to the red lesions. And the other thing is look at old exams. At our school, they kept old exams in the library. Some of the upper year students may have their old exams as well. So you can look at that. It might not be identical, but at least you can get a good idea of what the instructor is going to ask you. And the other thing is pretend you're teaching. So if you don't have a friend to study with, just sit at your desk and pretend you're the lecturer and say, today I'm going to teach you about white lesions. First one, lichen planus. There are 2 different types, and do it like that. And because you're making something as passive as studying to something as active as talking, you're going to remember it more. Advice on staying motivated. I know it's so tough to be in dental school after going through, 14 years of high school and 4 years of undergrad, and now dental school is another 4 years, and you're just so sick of studying. And so what should you do? So one thing is to set goals. So this would be similar to, when you're going out for a run, and instead of saying to yourself, well, I'm going to run 10 kilometers, because in your mind, you're thinking, oh, that's going to be brutal, and it's going to be so long, and maybe I can't do it. So instead say, yeah, that'd be great if I can run 10 kilometers. How about I just run to the next tree? And when you get to the tree, say, let's see if I can get to the next lamppost, and do it like that. And then you'll find that you'll probably get to 10 kilometers in about an hour, and you didn't even expect to be able to do that. The other thing is to make goals public. So, you can tell your friends, I'm going to study every single night for the next 7 days because, our exam is next week. So then because you said that, you're going to have to do it. So if one of your friends said, hey, let's go out tonight, you can say, oh, I remembered. I told everyone I was going to study every night, so I can't go out. The other thing is find your tribe. So find other people who are in the same situation as you, who your dental classmates. People are also struggling with motivation, because you guys can help each other, and you can vent to each other as well. Another thing is marking your progress. So if you have to read 8 chapters, before your next test, it seems like a lot, but just say to yourself, okay, I'm going to read a chapter a night. And then actually, mark it down. I read a chapter. It actually feels good to know your progress. Like when you're doing those home fitness videos, and it actually shows like how many minutes you worked out and how many more minutes you have to go. I love looking at that, because it's like, wow, I'm 1/3 of the way through. If I can do that, I can do the rest of the workout. Also reward yourself. So do something fun afterwards. That kind of makes you motivates you as well, knowing, okay, if I study every single night for the next 7 nights before my exam, I'm going to go out for ice cream after that exam. So reward yourself. And having fun just doesn't mean having fun after you achieve your goal. It means have fun while you're doing it. So, you can make studying more fun by, when I'm standing up and reviewing some material, sometimes I'm like dancing at the same time, or I'm drawing something along the sides and doing some artwork at the same time that I'm studying. So have some fun with it. Okay, so stress management. This is so important during dental school and during everyday life as well. And I'll start by saying stress is a choice. It's not something that someone does to you. You actually do it to yourself. And yes, someone might be, putting all these tasks and responsibilities in front of you for you to do. It is your choice to say yes or no to those things. And it's your choice on how you're going to handle those things. So I know it's very easy to say, well, just don't be stressed. But yeah, like you have to reframe your perspective on some things. And you also have to have some tips on how to handle stress, because there will be some times when we have a lot of things to do at the same time and there are high stakes involved. So these are all the things I do now, and I wish I knew how to do these things before. So I'll tell you my daily routine. And yes, I do these things every single day. So just like I eat healthy and sleep well and exercise every day, I also do these things every day. So not only do we have to work on our overall health, we have to work on our mental health as well. So the first thing I do in the morning is, even before I get out of bed, I list 3 things I'm grateful for. Then I meditate for 5 minutes. So that's just lying there and just thinking about my breathing. mindfulness. So even when I'm brushing my teeth, I'm not thinking about all the tasks I have to do today. I'm actually like feeling the water in my mouth, the toothpaste on my teeth, the brush strokes. So I'm just concentrating on the one thing I'm doing. Journal writing. So if I have any worries, I write in a journal. So that's my worry book. So that means I'm not ruminating about it any other time of the day. I'm not going over it in my head all the time, thinking about the past or thinking about what's going to happen in the future. If there's something I'm concerned about, it goes in that book, I close the book and I put it away. Another thing is positive self-talk. You'd be surprised at how many people say so many negative things about themselves. And if they ever heard anyone else saying those negative things, they'd probably say, hey, don't talk to that person that way. But meanwhile, we're talking about ourselves that way. We're saying things to us like, oh, how can you be so stupid? Oh, why did you do that? Man, you should have tried harder. Oh, everyone else did it but you. Would you ever talk to a friend that way? No. So why would you talk to yourself that way? Your voice is the most important voice you hear. The conversation you have with yourself is the most important conversation to have. So instead of saying all those negative things, say, oh, I didn't do as well as I expected. You know, what are some things I can do to, you know, do better the next time? How could I have prevented those things? Like have some self-compassion. Another thing that's been proven to improve your mood is to go outside, walk outside, get some exercise. So that is another easy thing to do when you have your study breaks. Go out for a quick walk. Another thing is to talk to someone. So be vulnerable. Don't internalize all of that inside of you. Because a lot of times, you know, I don't want to share my problems with other people because I think by expressing it, it's giving it energy. But you'd be surprised, the opposite actually happens. When you talk about your concerns and your worries and your failures, it actually releases the energy. It's like darkness going into light. You feel so much lighter afterwards. And even if that person doesn't have advice to give to you, even listening makes a big difference. It's a huge burden off your shoulder. And you may think, oh, if I'm vulnerable, maybe I'll be taken advantage of. Maybe people are gonna look down on me. No, every time I've been vulnerable, you know, the person that I was talking to actually helped me so much that my worries disappeared. So don't be afraid to talk about your worries, especially to someone you trust, like your family members or a good friend. The very last thing is have fun. I keep saying that. So yeah, do something you enjoy. Like think back to what you enjoyed doing when you're 10 years old. Like for me, it's riding my bike. So those are the types of things that I do when I'm stressed. Okay, here's a helpful hint that I also tell my patients to do, I tell my kids to do, is to just breathe. So when I'm overwhelmed, I will take my hand and I'll go, and this is what I learned from Dr. Sally Safa, is you inhale up and you exhale down. So I'll go. And I keep doing that until I calm down. So I'm just concentrating on my breath and my parasympathetic system will kick in and all of a sudden I'm relaxed. I'm no longer in that sympathetic fight or flight, scenario. And it works for my patients too. So it's a very good technique. You always have your hand with you. So it's something you can use all the time and anywhere. So when you are feeling overwhelmed, the very first thing you should do is to recognize your feeling. So there is the RAIN technique in meditation. R means recognize. So just recognize the feeling and say, you know what, I'm feeling shame right now. I'm feeling really disappointed right now. And then A is allow. So actually allow the feeling just to sit there. Don't push it away. People push away their emotions by distracting themselves, keeping themselves busy. I'm, a culprit for that. Or they'll do things to numb the pain, like eating or addictive things. smoking, drugs, alcohol. So instead, just allow the emotion to sit. And I is investigate the emotion. So actually talk to yourself and say, why am I feeling this way? And then N is nurture. So give yourself some self-love afterwards and say, you know what, I've gone through this situation before, I can do it again. So I'll just give you an example of this is a few years after I graduated, my father died, and I was 7 months pregnant with my son, my first, and I didn't express my sorrow. I didn't even cry because I thought I didn't want to have those emotions affect my son. So 2 months later, when he was born, I was still suppressing my emotions to the point where I didn't even feel any joy when he was born. So is that a good thing, to suppress your emotions? So now I didn't feel anything. Yes, I didn't feel sorrow, but basically I was indifferent to everything. So what I should have done at the time was recognize my emotions, processed it at the time instead of internalizing it, because then all those repressed emotions were being represented in other ways and harmful ways. So, the RAIN technique is a really good technique to use. So the very first thing is when you're feeling bad, instead of pushing away the bad emotion, recognize it. Okay, so now we get into the dentistry part. So I've been a general dentist for 22 years. This is my operatory that I work in. And this is my typical day. So this is just a screenshot of dental software. So most of my patients I book for about an hour, and I do quadrant dentistry. So I'll do, a couple of fillings and a sealant, for example, in that hour. So typically I do restorations. I also do some extractions. I will do some recall exams for the hygienist in between appointments. I'll do some emergency visits, maybe some post-operative visits. And, I work from 8 to 4 within 1 hour lunch break. So I see, 3 or 4 patients in the morning, 3 or 4 patients in the afternoon, and I write up my patient notes in the computer after each appointment. So it's very regimented. You have to have very good time management skills, but I love that because I'm a disciplined person. So I love the fact that each hour is different. A new patient, new procedure, it's fun. And here's another view of my operatory. So a lot of people always ask me if I ever want to own my own practice. And the answer is yes. So a few years after working as a general dentist, I didn't enjoy it. I even thought that it was the associateship. So, I switched offices, still didn't enjoy it. And I thought, well, maybe I should switch careers, or maybe I should get my own office. I thought maybe the problem is that I'm not making the decisions. So I went with a dental realtor who's like a real estate agent for dentists, looked around some offices, didn't find anything I liked. But then I got pregnant with my son, and my dad was sick in the hospital. So I thought this isn't the right time for me. And I always thought that, I'd have one child, a second child soon after, and that I'd stay home with both kids, until they started preschool. But a month after my son was born, I was dying to go back to dentistry. I actually miss dentistry. So just think, before he was born, I was actually thinking of leaving dentistry. And then a month after he was born, I was like, I miss it. I actually miss the feeling of the high-speed handpiece in my hand. I miss the patient interaction. So a few months after he was born, I went back into private practice a few days a week. And it was a new associateship. At first I loved it. Then, all the bad feelings started again, where I thought, oh, I don't like this. It's the same feelings I had with my other associateships. Then I saw an ad in the local paper to work at a dental hygiene school, and I applied. I worked there for 8 years. I loved it. It was just a lot of work, preparing for all the classroom presentations and exams. So then when a full-time public health opportunity came up, that's what I did. And so I've been working at this public health clinic for 10 years now, and I love it. So it just shows that, you don't have to have your own practice. You don't have to work in private practice. I work in a public practice. You can do other things like work in education. I even did things where I worked, for a company that did TMJ assessments on people who had car accidents. So there's lots of avenues in dentistry. So it just shows you have to be yourself because everyone else is already taken. I have had friends who took 10 years off from dentistry, to stay at home with their kids, and they went back. And to their own office, a few years later, they sold their office. I have friends who have bought multiple practices and they don't do dentistry at all. They do practice management. I have friends who just do research. I have friends who just teach. I have friends who just work 1 day a week. I have friends who work 6 days a week. I have, in general dentistry, you can focus your practice. So I have some friends who just take out wisdom teeth and they're general dentists. Some of them just do orthodontics. Some of them just see kids. You just have to be careful and not call yourself a specialist. But, you can pick and choose the procedures you do. So in dental school, we learn all the procedures, even orthodontics and implants and prosthodontics, endodontics, all the specialties. We learn a little bit of each. So you can choose whether you want to do a little bit of each. You can focus on a few things and, at least be comfortable with what you're doing and be happy with what you're doing. So I have patients who have very successful practices and they refer all of their extractions and all of their root canals. So they basically do restorative and preventive procedures. So it is totally up to you. You're going to learn everything in dental school. When you get out of dental school and start working, try everything, see what you like. If there's something you really dislike, and start the investigation as to why you don't like it, because maybe you just need more training. So take the training. If you still don't like it, then you can say, I'm going to refer these procedures. I'm going to keep the ones that I do like. And that's perfectly okay. Choose what you want to do. Because at the end, it's all about the patients. So patients are going to have expectations, and they may come into you on the first appointment and tell you how they want their mouth to look. And you have to be honest, and you have to say what you can do, what dentistry is capable of doing, and what will have to be referred or what just can't be done. So my main advice is to be honest with the patient. When I first started practicing, because I'm a people pleaser, I said yes to anything the patient wanted. I told the patient I was going to be able to achieve any results that they wanted. That's impossible. So now I'm very honest with my patients. Even if I'm doing a large filling, I will tell them before I start, this is a big filling, it's close to the nerve, you may need a root canal afterwards, it will probably be sensitive afterwards, and then they will decide, okay, let's go ahead and do it. Some of the patients will say things like, well, if there's a chance I'm going to be in pain or need a root canal, I'd rather not even do it. And, it's their choice. They have to make an informed decision after knowing all the facts, but you're the one who knows all the facts, so you have to share it with the patient before you start. I used to make the mistake of just going ahead and doing the filling, and then they would come back and say, my tooth is really sensitive. And I'd say, oh, well, that's normal. It was a really big filling. But they would look at you and say, well, why didn't you tell me that? Because so now it looks like your oversight, whereas if you told them beforehand, it's a big filling and it's going to be sensitive, then it looks like you have insight. And they'll actually say, you know what, you were right. I did have sensitivity afterwards. That was a big filling. But the good news is, the pain's going away. And they're not going to criticize you because you informed them beforehand and you told them about what to expect afterwards. So don't let what you cannot do interfere with what you can do. So tell a patient, if a patient comes in and wants an implant, you can tell them, I don't do implants. Or you can say, I will refer you out for the surgical part. You can come back here for the restorative part, for the crown. Or you can even say, that's beyond my scope of practice, I'm going to refer you to another dentist, because you want the patient to be happy at the end. So don't give them false hope. So what I wish I did differently as a new dentist, number one, I just wish I was honest with myself and honest with the patients. So I did some complex procedures that were way over my head. I didn't ask for help, even though there were other dentists that I worked with. Of course, the outcomes was bad, and these patients complained. Some of them, I even had to give them their money back. Some of the patients even left. Another thing that I did, which was so wrong, was I was like, oh, thank goodness I don't have an instructor looking over my shoulder anymore. And I was cutting corners. I was trying to go as fast as I could. You know, of course, the outcome was not good. So I quickly learned, it didn't take long, that I have to go back to the gold standard that I was taught in dental school. So do dentistry just like you're in dental school. And I still pretend that my instructor is looking over my shoulder and giving me a grade at the end. But instead, I give myself a grade. And I will look at all the criteria and think, okay, what was my time management like? My infection control, my communication, my prep, my final, my caries removal. I go through all those things in my head because I have to self-evaluate. That way I know what I'm doing well in, how I have to improve. So that way the patient gets the best outcome. So now we'll go over some of my cases. So this was a 35-year-old man. And when I saw him, he was always covering his lip, always looking down, not smiling. And he told me that he was unemployed and he couldn't get a job because of the way his teeth looked. He was very reluctant to show me his teeth, and it showed 2 large cavities on his 2 front teeth. So here are the options for these teeth. We can do root canals on these teeth, do posts and crowns, or we can take out those 2 teeth and make a denture, or there's other things we can do to replace the teeth besides a denture, like a bridge or implants. So this patient's unemployed, low income. So he chose the least expensive option, which was to take out the 2 teeth and to make a denture. So even though you know this person has a low income, you should provide all the options to him. Let him decide. He would be very upset if you just took out the teeth and made a denture and then realized afterwards there were other options to keep the teeth. Even if he did decide to keep the teeth, and you still have to tell him, you know, about the prognosis. You can say, you know, these cavities are very big. There's not much tooth structure left. Even after you do the root canal and do post and crown, the teeth might break. You also have to see, you know, how well is his oral hygiene and his diet? How healthy is the gum and the bone around the teeth? Because if he has a habit that is creating these huge cavities and he's not willing to stop, then you really have to think about whether it's worthwhile to keep teeth if they're going to constantly be destroyed with decay. So there's a lot of things to take into consideration here. But he was very happy with the result of having the teeth taken out, the denture, because it meant he can go for job interviews, and he got a job. Okay, my second case, you can see the molar has a very large cavity in the roots, and also there's blackness at the tip of the root, which is an infection. So this was, and then you can see in the photo, the cavity was so big that it split the roots apart. So now you have the root towards the palate, which is all by itself, and then you have the other 2 roots by the cheek side, you know, still together. So this was actually an easy tooth to take out. It was considered a simple extraction. The tooth was already split, so I didn't have to split it. Here is the challenging part about this case. So the patient's blood pressure was very high, and he was on blood thinners. So when the blood pressure is very high, we can't even do treatment. So I had to tell him the first day, your blood pressure is too high. I can't do any treatment. You're going to have to see your medical doctor, and you can come back once your blood pressure is lower. The other thing is he's taking blood thinners. So after an extraction, if he had just taken his blood thinner before the extraction, there'd be a lot of bleeding. And because I knew he was taking blood thinners, I also made sure that afterwards I put some, as a hemostatic agent, something like a little sponge in the socket to help stop the bleeding afterwards. And I gave him lots of advice on how to prevent bleeding after the extraction. So you have to always consider the medical history before you do any treatment. So yes, it's a simple extraction, but you can't even do it if the blood pressure is too high or if you just took a blood thinner. Okay, so this is an interesting case. A 7-year-old girl fell at school and her front central incisor came right out. So that's called an avulse tooth. So the proper treatment for this is for the child to pick it up, rinse it with some water, put it right back in the socket, or a parent or a teacher do this for her. So in this case, what happened is, the good thing is someone found the tooth, but they put it in tissue and stuck it in their pocket. And I saw this girl 3 hours later. It's best to see the dentist within an hour. And it's best to put the tooth either back in the socket or in a cup of milk or in the cheek or in a cup of spit to keep it moist. So it was dry and it was out of the mouth for an hour. Some dentists would say, this is hopeless. So wouldn't even try putting it back in. I thought, what do I have to lose? So I rinsed it, put it back in, put a splint. The splint stays on for a couple of weeks. Within those couple of weeks, she came back for a root canal. So she needed 2 root canals because both of the teeth broke, both were infected. So at first I thought, wow, that's a pretty good result. Looks back to normal. So she was happy, her mom was happy, but then she fell again. This time it was the other tooth that came straight out. I've never seen a case like this before. So the big tooth on the right came out. So this was a holiday weekend. So the mom took her to a children's hospital. The child had some special needs, so she was able to be seen there. And the tooth was put back in. But unfortunately, this time when the child fell, it was a very bad break. It broke some of the bone as well. So even though the dentist put it back in, you know, when she saw me a couple of days later, it was dangling. So it did not stay in. So I had to take out the 7-year-old's front tooth. After I took it out, I went in the other room and I started crying because I've never had to take out a front tooth, permanent tooth, on a child before. So with a missing tooth, a denture was made. And then when she's older, she can think of getting an implant or a bridge or, you know, a better shaped denture, because right now all her teeth are coming in at different times. Some are adult teeth, some are baby teeth. So it's not the best aesthetics, but I'm sure she'll have a good outcome when she's older. Case 4, another child, she's 2 years old, cavities on the front teeth. At that young age, she's not going to be cooperative for treatment in the office. So what's the treatment? To go under general anesthesia and get these fillings done. So her mom didn't want her to go through that procedure, you know, weighing the benefits versus the risk. I also agree. So we did something else. So we just want to stop the decay until she's older, more cooperative, where we can do the fillings. So I use something called silver diamine fluoride. So it's just something I painted on her teeth. The unfortunate thing is it does turn the cavity black, but it does stop decay. So silver diamine fluoride does 3 things. It arrests the cavity, so it stops it. It's not gonna get any worse. It also decreases sensitivity. It also prevents future decay. So and the child doesn't mind, the mom doesn't mind. In a couple of years, she'll be cooperative and I can do regular fillings on her. Okay, the last case is my case. So About 5 years ago, I was riding my bike, took a sharp turn on a gravel road, fell over my handlebars, and broke my front tooth on the left. And I didn't even realize I broke my front tooth. I just realized there was a lot of blood on my lip and my shirt because my lip hit the pavement. So I went home and I looked in the mirror and I noticed my tooth was broken and my lip was still bleeding. So my lip bled all day. I went to see my dentist. He restored my front tooth, but he was also asking, where did the piece of your tooth go? And I said, yeah, that's a good question, because I actually went back to the site where I fell and I was looking for the piece and I couldn't find it. And I'm sure I didn't swallow it. So he took a picture, an x-ray down here, and you can see in the middle, the part of my tooth that broke got stuck in my lip. And that's why it was bleeding all day. So I went to an oral surgeon. He's like, ugh, I don't really want to dig in your lip trying to get that out. Let's just leave it. So the tooth, part of my tooth was left in my lip for a few months. And then the oral surgeon saw me and he's like, yeah, I can see the outline of your tooth in your lip. It doesn't look that great. Let's see if I can take it out. So he went from the inside, took out the piece. A lot of little fragments are still left in my lip because I chipped off a lot of the corners of my teeth as well. But it just goes to show you that you can break a tooth, it can be stuck in your lip, you can leave it there as long as it's not anesthetic or not causing an infection. But now what I do is I wear a mouth guard when I ride my bike. So, you know, case presentation even included me. So here are my top 5 tips overall for dental school and for your career as a dentist. Number 1, connect with other dentists. So you can do this by joining your local dental society, by joining study clubs, by staying connected to your classmates, and even doing things like going on social media and following other dentists and sending them DMs with your questions. Number 2, make good choices. So remember, stress is a choice. Remember, every time you say yes to something, you're saying no to something else. The way you handle situations is a choice. You know, being honest with your patients is a choice. Being honest with your own abilities is a choice. Number 3, treat yourself and others well. So that is self-compassion. That is taking care of your health and wellness, your mental health and physical health, and treating others well, because you're going to feel good about yourself. And then they will also, you know, reciprocate and also treat you well as well. Have fun outside of dentistry. So I do a lot of hobbies within dentistry with my volunteer work and my advocacy, but I also have fun outside of dentistry. I like walking my dog. I like going for hikes. I like spending time with my friends. Have a life outside of dentistry. So dentistry doesn't have to be the most exciting thing in your life. You know, if dentistry is, you know, repetitive and predictable and you're happy with that, that's great. Find your passion outside of dentistry. And number 5 is keep learning. So that not only does that involve learning about dentistry, learning about all the new materials and equipment and techniques, but also learning more about yourself, learning how to cope with stress, learning, you know, new hobbies, you know, just constantly, you know, keeping the passion of life alive. So these are my top 5 tips. And I'm going to end with a quote from Nelson Mandela. I'm not what happened to me. I am what I choose to become. So please remember those famous words. And now is our time for the Q&A. I really appreciate you listening to my story. I hope you learned some tips and learn from my struggles and stories. And I just like to remind you that you can email me or you can send me a DM on Instagram. I'd like to thank Deshawn and Ellen and Betty and Tina. I'm going to try to see who else is on. I'd like to thank Gazelle for inviting me. and Scott and Aishu for helping out behind the scenes. So Ellen, do we have any questions?
Yes, but before we get started, I just want to thank everyone for coming to our first dental shadowing session, and it means a lot. So after the session ends, we're going to be posting the quiz in our Instagram bio in our link tree, and as long as you get a 4 out of 6, you'll will earn all the credits and your hours. So we will send you a code after you submit your quiz, and that will just be your code. So every time you don't have to put your name and email, you can just use that code to do your quizzes. So we have a couple more questions. Let me start. So one of them is that what is your advice to mature students? I sometimes feel that I am a bit too old to pursue a career as a dentist. I am currently studying for my undergrad, and I probably will be in my 30s when I get accepted. So
actually, the 30s isn't old at all. I had someone in my class in their 50s. I know someone who specialized in their 60s. So it's actually, when I taught at a dental hygiene school, my best students were actually the mature students because they were passionate about what they were doing. And even though they had a lot of other responsibilities like children and parents that they had to look after, they were so disciplined and had such good time management and focus that they did very well. So yeah, for that mature student, I'd say go for it.
okay, perfect. We have another question. What are the operations that you can practice as a general dentist?
Okay, so all the procedures, is that what they're asking? Okay, so you can do restorative, so fillings, crowns, you can do veneers like cosmetic dentistry, whitening, preventive, so you can clean teeth as well. You can do root canals, which is endodontics. You can do bridges, partial dentures, full dentures, implants, which is prosthodontics. You can do braces, so orthodontics. A lot of general dentists do special training in Invisalign, so you can do that as well. So you don't have to be an orthodontist to do braces, but make sure you don't call yourself a specialist when you're not. You can work on any age group, and you can even focus your practice and just work on seniors or just work on, the business class and have a practice set up, in the downtown core and just work on people who work near you. And you can also do oral surgery. So that'd be extracting teeth and doing even sinus lifts and bone grafts. So for some of the more complex things, like with oral surgery, as a general dentist, you're not going to be doing things like facial reconstruction, because those are things that oral surgeons would have to do with their specialty training. So really a general dentist is a jack of all trades.
Perfect. We have another question. It says, how can a dentist handle the business when they have their own practice? Does the business course at dental school help enough?
So that's a very good question, because when I went to dental school, we didn't have any business training at all. And there are courses offered afterwards. Like in Ontario, both of the dental schools have, like mini MBA practice management type courses, so you can take those. Some dentists will hire an office manager or a practice consultant. And most of the dentists were able to actually learn the business side on their own, starting with a small practice and learning, and learning as you go, and to make sure that you have, some professionals like an accountant, a lawyer, a financial advisor, a practice consultant to help you with all of those things. So actually I found that my friends, even straight out of school who bought their own practice, they did really well with the practice management, even though they didn't have any business training. So you'll be surprised with yourself. Like when you have to make it happen, it will happen.
Perfect, thank you. And another question is, I know as a dentist, you're always sitting and kind of leaning over, I guess, to work inside the mouth. Have you experienced any back problems or any pain?
That's good. You really have to consider your physical health because you want to have a long career as a dentist. I luckily, in 22 years of practice, have had 0 back issues. And the reason why is because I exercise almost daily. I do yoga and Pilates. I'll do like weights, concentrating on my back. So because of that, I haven't had any problems at all. And I also wear loops, so the magnification glasses, so that I'm not hunched over looking in the mouth, that I could sit up straight. Actually, if I hunch over, then it goes out of focus. So I have to sit up straight in order to get good focus with my loops.
Perfect. Another question is, how competitive is getting into dental school in Canada? Is a 3.8, 3.9 GPA competitive enough? And
Yeah.
can you do braces for general dentists?
What was the last part about general dentist?
And as a general dentist, can you do braces?
Yes. So for the first part of the question, yes, 3.8 and 3.9, those are great grades. It is very competitive to get into dental school in Canada. There are only 2 schools in Ontario, about 10 nationally. So it's not just based on your grades, it's also based on how well you do on the DAT and the interview and your essay. So those are great grades. So when I went to dental school, my average was, in the high 80s. And the second question about braces, yes, a general dentist can do braces.
Perfect. And also, how is it being a dentist now during the pandemic compared to being a dentist before the pandemic?
Excellent question. So it was very challenging at the beginning because we were limited to emergency care only. Now we can do essential and non-essential care, so we can do all procedures. They are asking us to limit the procedures that generate aerosols. At first, I didn't like working during pandemic conditions at all because of all the PPE. It is still very hard to work with all the PPE because it gets very hot and it obstructs your vision as well. Now I'm getting used to it. And now because we actually have to allow a 15-minute fallow time after all the procedures, based on the airflow at my office, I find that myself and the rest of the staff actually like it better because the pace is slowed down. Because before we were just rushing, we were working. And so now that we have a little bit of break after each patient, we actually have time to write our notes and have time to do infection control without rushing. So actually am happier now during the pandemic than I was pre-pandemic.
Thank you. Another question is, how often do you do cases involving children under general anesthesia?
So at my office, the only type of sedation that's offered is nitrous oxide. So for children who need general anesthesia, I will refer them to a pediatric dentist that has a general anesthesia team come in, or I refer them to a dental anesthesiologist who is qualified to do general anesthesia.
Perfect. What advice do you give a woman balancing work in dentistry while raising a small child?
I actually think dentistry is a fantastic career, not only for women, but for males as well who want to spend more time with their children. Because when my kids were young, I only worked 2 or 3 days a week. And, if I was working in a corporate job at a bank, I would have to work full time. So as a dentist, you can set your own hours. And I actually think it's ideal to be a practice owner and be a woman, because then you can even say things like, I'm going to start later because I want to drop my kids off at work, or my child has a concert that I want to go to, so I'm going to take this day off. So you have even more control over your schedule. So it's actually ideal for anyone who wants to juggle, a family and career, because you can set your own hours.
Perfect. Do you apply collaborative medicine into your practice?
So for example, for collaborative medicine, there are two ways you can look at that. And that is, one is if you work in an interdisciplinary team with medical doctors, and they do have clinics where, there is a dental suite amongst a medical clinic. So that'd be one way of doing collaborative medicine. But actually, as dentists, we actually have to look at the medical history and see if there are any contraindications or any precautions we have to take before we can even look in the patient's mouth. So there's actually medicine applied to dentistry for every single situation.
Another question is, how do you make the best decisions for your patient? Because I know that it can be a lot of pressure or a lot to take in onto your hands. Do you ever consult with your coworkers for another opinion?
Yeah, so for the first part, it is very challenging and complex cases to determine what is the best option. So what I always do is present the patient with all the treatment options and the prognosis, and then I'll actually give them my advice saying, you know, this would be the option that would be the best, but I always let them choose. I always let them bring in family members to help make the decision. I tell them they don't have to make the decision now. I will give them my phone number and say, if you want to talk about it on the phone later, they can, and they actually do. And so it's just give the patient as much information as possible. So they're actually making a decision, not you. And the second part of the question, can you just repeat that part? It was about.
Yeah, do you ever consult with your
Okay. Yeah, so luckily I work with 3 other dentists. So we will show each other x-rays and say things like, what would you do? And before we refer things out of the office, we'll ask the other dentists if they would like to do that procedure before we refer them out.
Perfect. Another question, this is the last 2 questions. I noticed that on case 4, the child had a very short tooth. Did you guys remove the gum while she got the treatment?
I think case 4 was, is that the 2-year-old? No, so we didn't remove the gum. Yes, she does have a gummy smile, but she's also young. So what we'll do is we'll wait until her adult teeth come in, until she's around 12. We'll see if she needs braces. And if the gums are very low and she has a gummy smile, a gingivectomy can be done. And I would refer her to a periodontist for that. So that way it looks more like her teeth are the proper length for the size of her face.
Perfect. And the last question, how different has dentistry become since you've been practicing for 20 years?
It actually just keeps getting better. I'm just gonna. Sorry about that. It actually just keeps getting better. The materials get better, the equipment gets better, the education gets better. So I actually like dentistry more now than I did when I graduated. And I'm more confident now. So I think it's a fantastic career for anyone to get into.
Perfect. Thank you so much, Dr. Sanj Mohanta, for being our first guest in the Virtual Dental Shadowers. We appreciate it a lot. We've learned a massive amount of information, and we just want to say thank you.
Oh, you're welcome. And I know I didn't get to everyone's questions, so please email me with your questions afterwards. And good luck with all of your careers in dental school and in dentistry. And please keep in contact and please stay connected with each other as well.
Thank you so much.
You're welcome. Bye.
Bye.